Greetings and praise the Lord, Pentecostal Assemblies of the World. I am Dr. Rayvann and I am so excited that you have decided to join us this morning for part 2 of this C.H.E.W conference. Hopefully you were with us last night where we shared a lot via panel concerning some things that we are going to go deeper into today. Our first presentation will be provided by Dr. Karen Douglas and Dr. Olivia Burkett, and they're going to be sharing more in depth about the impact of COVID-19 transgenerationally, across generations. That means you, your mama, your grandmama, your kids. We're going to figure out how we are all being impacted, what issues are arising, and what we can do. So I'm asking you to like, share, let somebody know that the Pentecostal Assemblies of the World's Committee on Health, Education, and Wellness is back at it, and we have some information for you. Enjoy the presentation, and we will be back.
And I have with me my good friend and sister in Christ, Dr. Olivia Burkett, and we are going to talk about the generational impact of COVID-19. We know that it is an insidious virus that is no respect of person. It doesn't matter what your age is, what your ethnicity is. It doesn't matter, because all of us are experiencing COVID-19 just like the other person. We're all in the boat together. So Dr. Burkett, why don't you start off and just give us some stats on COVID-19?
Well, Dr. Douglas, the stats with COVID-19 changes daily. So in order to be accurate about that, you almost have to be listening to the news right now, right this minute. So instead of looking at the exact numbers of where we are now, I think we'd be better served to look at how the family dynamics are changing as a result of COVID-19. And I'm excited to share this with you. And I'm going to give our audience, our viewing audience, heads up. Dr. Douglas and I are good friends, and we have the same personality type. So we're both ENFJs, and so we may butt in there on each other because we're excited about something, but by no means is that meant to be disrespectful. We're just excited. So again, I want to thank you all for tuning in to the Pentecostal Assemblies of the World Committee on Health, Education, and Wellness. And we will discuss, like Dr. Key said, children, grandchildren, parents, and great-grandparents, and how those dynamics are constantly changing as a result of this virus. One thing we want to be mindful of is we want to make certain that we please God in all of our interactions and behaviors with our family members. And this virus has all of us excited, anxious, stressed, and we could cross lines and ruin relationships. We don't want that to happen. And that's why we're going to share some of the things that have been shared with us, stories that were told, concerns that have came about, issues that have arisen, and also even some complaints and maybe even some threats to lawsuits. So with all of that in mind, we're going to share what we've been told, our personal opinion, and even our professional opinion. Now, Dr. Douglas, I'm so proud of, because she's my friend and she's very smart, has her own private practice. She's a clinical psychologist and she's very good at it. But she's had other experiences that will better serve her this morning as well. She's worked with her brother in pain management. She's worked at a university, so she deals with students, and then she worked in her church setting, so she's well-rounded. And what she shared with us today will pull from all of those areas and all of those arenas. And me, on the other side, I'm also a university professor, have been 20 years and running. I have 23 years of experience serving as a director of psychology in a mental health setting. And I'm also licensed and certified as a school psychologist in a position to address both academic and behavioral issues with children and provide some consultation to families. So, Dr. Douglas, with all that being said,
But
I'd
before
like
you
to.
do that, Dr. Burkett, just let me first of all welcome our audience. I do
Okay.
apologize. I
Okay.
forgot to welcome the most important people in this whole process. Welcome to those on Facebook Live. We thank you for getting up so early in the morning for some of you. And then also, we want to thank our presiding bishop, Bishop Brooks, again, for having the foresight and the tenacity and just the strength to be able to stand up and allow us to be able to talk to the people of God about mental health and being whole, healed, and delivered and set free. And then, of course, our leader of the of our committee on health, education, and wellness, Bishop Roland Harrison. Thank
Yes.
you, thank you, thank you. And we again are so excited about this today. You're gonna see a lot of different things during this conference.
Absolutely. Absolutely. Yes. So why don't we start with what I think a lot of people can relate to, and that would be the older generation and our grandparents and great grandparents during this season. And it was shared with me on one occasion that an elderly mother in her late 80s, that makes her an octogenarian. She's almost 90, and she does not appear to want to listen to her daughter, who is responsible in some ways for her safety, health, and wellness during this pandemic. And I'm thinking, Dr. Douglas, that, parents always feel that we're the children, and they always think that they don't really need our advice on what to do. But as a child or the daughter or the son of that elderly parent, we may know some things that they may not be aware of that could endanger them. So what do you think we should do to get parents who, some may say, oh, they've grown, what's that, ornery, old and ornery, or mean and ornery and all that, and that's usually meant in a light way. But with that family dynamic, okay, think about it. You want to be respectful, and you don't want to do what the Bible say. You don't want to disobey your parents. You want to respect them at all times. So how would one approach an older family member who appears to be set in their ways and think that, whatever they think about COVID, they're not really where you believe they should be in acknowledging the dangers thereof?
That's an excellent question, Dr. Burkett, because I cared for my mother during the last 2 years of her life, which the last year we were in the middle of COVID. And she did have she did not have dementia, but she was, as I would tell her, your brain is old. So there's some things you're going to get confused about. And so I think that when you're dealing with elderly people, especially if you are their caregiver, you have to understand the perspective in which they're coming from. Many of our parents, they worked very hard to get what they have. So you can't just abruptly move them out of their homes. You can't abruptly try to tell them what to do. You have to deal with them with compassion and dignity, and, sort of make suggestions. And what I would do with my mother, I would give her a choice. You could either do A or B, making her think that she's actually making the choice. However, whatever choice she made was in her best interest. And when my mother passed, I realized being able to care for her during her final days was the greatest blessing that I could have ever had. So when even though you may get frustrated, you have to be prayerful, because they can push the buttons. Like you said, Dr. Burkett, they still look at you as a child, and they may not always want to hear what you want to hear. But I asked God to give me the patience. And then as I began to see when my mother would do things that would normally be frustrating, they actually were funny. There was humor. So you have to use humor in the situation. You can't take it personally. You just have to have a heart of compassion. My daughter asked me something. She said, "Are you so detailed and sensitive in the way that you deal with Granny because you would hope that," and I only have one child, "hope that I would deal with you that way?" And I said, "Absolutely." And so again, it's that tenderness, that level of respect. Our parents we have to make sure that whatever they're going through, even if they're being honorary or, you know, combative, we still have to have the patience to deal with them with compassion and dignity. And I think that was the thing that brought my mother and I so close together, because I learned so much about her and who she was in her final days.
And you don't want to ruin that relationship, you know, because you can't get them back. Once they're gone, that's it. Another thing I thought of is like the challenge to engage them, to converse with you about it. A lot of our parents, even though they're elderly, they're very, very in tune, and some are more in tune than others. And that's what I believe we'll have to figure out when we converse with them. And so with this COVID season, you know, I guess if you really want to know where they are and how much they're aware of the dangers thereof, you just have to find a way to get them to invite you into that conversation. And so this one person's mother was like, just like not wanting to hear it. So my suggestion was, ask her, where is she getting her information from? You know, if you know where they're getting their information from, then that could probably help settle the problem as well. If they're getting it from any source other than CDC or the World Health Organization or some other source, maybe another friend, you know, they all have their friends. So then you may sit down with them maybe and go through what it is that they believe to be true about COVID. And even at that, you still may not be able to change their mind.
And Dr. Burkett, another thing that we can do is sit down with our parents and watch information with them.
Exactly.
You know, ask them questions. Well, what do you think this means?
Right.
You know, what are you feeling about this? And for those that may not have the best understanding, I remember towards the end, my mother asked me, is COVID coming to visit? And I said, I hope not.
I know.
You know, and then I had to try to explain to her that it was a virus. It was something in the air. It was something you couldn't see. And that's why you wear your mask. And I explained to her about being safe and washing your hands. And I remember she told me, I always wash my hands. I don't need you to tell me to wash my hands now. I said, well, okay, we're going to leave that alone. And I think we also have to know when to back up so that we don't appear to be offensive or talking down to them. But right. I think watching that information together, sharing the information, letting them explain to us how they see it or how they perceive it will also be helpful.
And maybe even telling them what we're worried about. So my concern is this, mother or father, and these are the things I'm concerned about. And who knows, they may have something to share with you that may relieve your pressure. And then the other thing we have to think about is where they are chronologically. Okay, they're in that last phase, that last period of their lives, and they're thinking about one or two things. If they've lived their life and lived it well, and they've accomplished all the things that they wanted to accomplish, they're probably in a good place and not really concerned that much about COVID, because they'll say, well, this too shall pass, and they have a good understanding. But then there are the older adults who may not have done all that they felt like or they could have with their lives, and may be experiencing some anxiety and depression because they're looking at all of the missed opportunities. Okay, I'm now 80 plus. There are a lot of opportunities that are missed. I can't get back. And these are the ones who may be experiencing some depression and anxiety. So what do you think we should do? And you can pretty much tell where your parents are. If they're happy and bubbly and like, if Jesus come tomorrow, I'm fine. Or they're like sitting and quieter and making statements that make us feel like, you know, there's some regret. So the ones who are happy, they're good to go. But those who may appear to live with some regrets, what do you suggest or think how we should approach that to make them more comfortable their lives?
You know, we cannot undo regrets. We can't undo the past. But I think something that we can do for our parents is encourage them that you've been a great mother. You've been a great father. You've done all that you could do. Acknowledge the sacrifices that they have made throughout the years. You know, focus on the positive, and even just having them, you know, as you say, talk to you. And I think sometimes when people get older, especially when you're caring for someone that's older. You have so many other things that you have to do in that process that we don't take time to just engage with them. I know, and I'm going to keep going back to my mother because that's a personal experience, but she liked to do sticker books. So sometimes when she would get down, I would say, hey, Mom, let's do a sticker book. Even though at the end she would put the stickers all over the place. It wasn't making a picture. We would color, we would do puppet shows and things like that. So things that will encourage them, that will lift them up, just engaging with them. Many times that will take their mind off of their regrets. It would take their minds off of what they didn't do and what they could have done, what they should have done. So I think just engaging them and being a part of their lives, because so many times we push our elderly parents to the side, even if it's not a pandemic. Many times they are the ones that we don't attend to. As long as they have food, clothing, shelter, that's it. But we have to engage with our parents. We have to let them know that they're important and we appreciate them and that they are part of the family and they're valuable.
Absolutely. And I like the engaging in the greater connectedness. And if there are other siblings, they need to step up and engage as well, because the more your elderly parents feel the connectedness with all of their children, it'll help them feel more fulfilled. And I think one more thing we may want to add to that is encourage them to engage as it relates to their spirituality. I know that churches are closed now for the most part, and a lot of it is being done by Zoom. But if we can get our parents to engage in that aspect as well, I think that'll help lift their spirits. And I think that it would be doable if they're getting the conversation from their children, engaging in activities, as well as allowing them to focus on their Savior as well. That's awesome. So in lieu of time, and because we're both extroverts and we'll go on and on and on, let's just back up a little bit and focus on that person who is that, what I call a member of the sandwich generation. You've got kids you're taking care of and parents. And if you fail to take care of yourself, it could be some real issues. These individuals need to find some balance and stress. So I'm going to ask you, what would you suggest individuals of this generation to do? I thought of some strategies, and the number one thing I think is you got to be able to say no, state what you can and cannot do, and say no when needed. Self-preservation, because if you're not taking care of yourself, you're not going to be able to provide for your children or your parents or grandparents. Do you have any other thought on some of the things we should do in caring for our parents as well as our children? Because this caregiver's role could last decades and
Absolutely.
decades.
I think the primary thing, as you stated, we have to be able to say no. We have to be able to create boundaries. But I think also the most important thing is self-care.
Yes.
It's kind of like when you're on that airplane, and even though there's not a tragic situation going on, but the stewardess says, if something happens, you make sure that you put on your own mask first.
Yes.
And then you help those children and those that are may need your assistance. And I think that it is so important for us to do self-care. And because if we don't, we burn ourselves out. That's when we become irritable. That's when we're not able to give what we need to give. So I think that is the primary thing, self-care. And what does self-care look like? What do you think, Dr. Burkett?
Well, you thinking in terms of what are some ways I can take stress off of myself, and I can function and be my best self. And if take for instance people like us who are still in the workforce. And if I had a parent in the home with me and children at this time, I'd be looking at some employees' paid and unpaid benefits right about now. I wouldn't want to continue to put 40 hours a week in and come home and see about children and see about parents, because I know that would be overwhelming and it probably would not turn out well. I would probably solicit help from other family members and friends, neighbors, church folk. Your parents sometimes have friends who are neighbors and maybe even people who attend church with you. I wouldn't feel too proud to ask for help. I would make sure that I'm not just taking on more than I can do. And so I would find time to rest, to relax. I'd probably wake up in the mornings and ask myself, even before I get out of bed, first, Lord, thank you for allowing me to open my eyes. And what is something simple and small I can do for myself today that could bring me some pleasure, just, a distraction. And then, you know how we all have those favorite friends that whenever you talk to them, you're going to just laugh, 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 laugh. I'd make certain that that friend and I were available to each other for a few minutes on a regular basis. Mm-hmm. And I tried to carve out me a good 30 minutes every day just for me. If I had to go and hide, I'd have those 30 minutes to make certain that I took care of myself.
You said something that made me think of what they used to say back in the day, probably when we were children. Reach out to people. And, in this crisis that we're in this world crisis, it yes. really does take a village.
It does.
We are all in it together. And I think that, we have to be able to reach out while self-caring for one another ourselves. We still have to reach out and be there for one another. So I think coming together and realizing that, as you stated, that there's a friend, that there's someone that is experiencing the same thing that you are experiencing, and kind of coming together and helping each other through it.
Amen. Okay, so moving right along in lieu of time, there are other members of this family, other dynamics we need to look at, and that brings it down to the teenagers, the adolescents. I feel my heart goes out to adolescents right now, because I know that without COVID, their lives is storm and stress anyway. Just to be an adolescent, everything is super important. You have this exaggerated ego, and, at this time, you're still making decisions with the part of your brain where your emotions are experienced. And that's why you see when adolescents talk and share, they just seem to be so emotional about everything. And we as parents sometimes will look at them and like, girl, boy, because we look at them and we expect their behavior to be as mature as the size of their bodies. And some of our adolescents may be larger than we are, in stature. And so our expectations from them are unrealistic at times, because we want them to behave like an adult. And I think that creates more stress for the adolescent and for the parents. So believe it or not, they are going through something right now. They're being robbed of their school prom. They're yes. being robbed of the graduation. So what can we do to let them know we see you, we feel you, we have compassion for you. We know this just doesn't seem fair, kind of take it to where they can understand it, put a little emotion in there and say, I feel you. This is, nobody's fault, but how can we give them back something, some kind of control or authority or some kind of leadership in celebrating those milestones, or just what can we do for our teenagers, our adolescents, to help get them through this? Do you have any thought on that, or teenagers in your midst?
I think that people are doing somewhat of a really good job on being able to address our teenagers, especially those that are missing out on proms, that are missing out on graduation, these drive-by, prom things and graduations. I think being creative, kind of helps with that, although it's nothing like they would experience if they were actually at their graduation. But I think acknowledging that we, like you said, we see you. We yes. appreciate you. We appreciate the hard work that you've done. But I think the thing that really we have to be careful of with that age group is to make sure that they don't slip into feelings of helplessness and hopelessness, that they don't begin to feel less motivated. Because what I found in my practice is a lot of them say, well, what difference does it make? I'm not going to be able to have the college experience like, maybe my older brother or sister have. So I think that we just have to watch our teens and our adolescents. And if we see signs of depression or severe anxiety, we have to begin to address that and not just act like it's going to go away. So in order to do that, we have to be open to mental health treatment.
Absolutely. And another thing I'm mindful of is the teenager from the biological perspective. their brain is still developing, and they are so prone to things that could hurt them for the rest of their lives. If not carefully watched, they could become involved in alcohol or drugs, and it could make a major impact in what their lives would look like in the future, especially if experienced during that adolescence when the brain is still developing. And so the other thing that's crucial with the brain development at that time is that this is the first time in their life that they value and quote unquote puppy love, care for someone else as much as they care for themselves. So social interaction then with their peers is like paramount in importance. So what's so weird for them is this is the time in their life when they really need their friends. This is the time in life when they seeking that independence and time away from parents. And contrary to that, it's just the opposite. They're stuck in the house with parents, can't get away from them, can't get to the friends. And this is the most important time in their life when they actually need the opposite of what's available to them. So again, to help them get grounded and remain grounded where they don't make some mistakes that could possibly interfere with the rest of their lives. One thing we could do is make certain that their sleeping patterns and sleep habits are where they need to be. You know, the adolescents need about 9 or 10 hours of sleep, and their sleep clock is like starts later at night. You know, they don't need sleep until later in the night, and they tend not to want to wake up until later in the mornings. And that's why the school districts even change the time of day for them a little bit based on their biological clocks. And so if they get that 9 to 10 hours of sleep that they need, that in itself could cut down on stress and depression and anxiety, and make them feel a little bit better. And the other thing is we got to be mindful that they've suffered a lot of losses too. Yes. And I think we need to allow them to grieve those losses, you know, allow them to be sad if they need to be sad, you know, allow them to go through and process grief and not hurry the process alone. Just allow them to feel their feelings. And I think sometimes as parents, we may get a little bit in a hurry for them to grow up, you know, be more responsible, engage in adult life thinking. Mm-hmm. And we want that sometimes before their brain is there. And I think that's something we need to be more mindful of. And so I appreciate your comments there about them, but on a final note, some tips for teenagers.
You know, but Dr. Burkett, before you go on, I think there's a group that we did not really cover, and that's the group of maybe those that are 35, 40, that really they're responsible for themselves. And I particularly want to think about those that may not be living close to their families. They may be living on in another state or something like that, and they're kind of out there alone. Possibly that may be how they feel. They have friends, but they may be living and working away from their families. How can we make sure that our adult children are safe and feel connected to their loved ones?
That was the operative word, connectedness. And I've been saying that on and on and on. We've got to make sure we use advanced technology, laptops, telephones, and whatever else we have, FaceTime, Zoom, and stay connected. You know, connectedness is key. And so when a person starts to feel and experience all of the emotions and the stress that comes along with trying to just get through this virus and stay ahead and keeping your finances in order and making sure that when this thing is over, everything is still in motion the way it needs to be, it can be very stressful to those young adults because they're in a period of their lives where they are just putting things together. They are on their jobs and sometimes the beginning of their careers, and that's stressful. And so it's like, so unfair. I'm just starting my career. I just landed this amazing position. And now this virus comes along and that's just upsetting everything. And then you are away and you don't have mom or daddy in the same house to say, baby, it's going to be okay. We've got to use modern tech, stay connected. I would suggest, and they may not want it every day, but I would suggest reaching out to them daily. Yes. And just say, look, I just want to look at you. I just want to see your face. I know you're 30, but you're still my baby. And if I know you're good, I'm good. And so just that, I think will.
So maybe practicing physical distance, but not social distance.
Right.
Staying connected socially. We had a question about what, and this may be a little bit off of, the impact on generations, but we had a question related to what is the reward in working in the mental health field?
For me? Wow.
Yes.
Okay. You know what? That's a really good question, because prior to actually working, what I call being gainfully employed, where there's a check attached. Prior to that, for some reason, I was that person that people always wanted to share those type things with anyway. And I don't know if it was my personality or what, but it was just kind of a natural thing for me to be with a person. And if they're sharing with me, it was just natural for me to make them feel like they're the only person in the world right now, giving them all of me in that moment. And so for me, just giving people all of me in that moment, whatever the interaction is, whether it's an assessment or whether there's a conversation occurring or whatever, makes me feel like I'm purpose driven. I feel like people need to know that someone cares. And even though as a professional, we don't get into the sympathy, the empathy is there and people pick up on it. But I feel like there are just certain of us that God has preordained to be there for others, to understand others, to not judge others, and it's a lot like what the scripture says. Jesus died for all of us, and it doesn't matter what we have done. It's like his blood can cover that, and he can forgive us, and he doesn't judge us, and he just wants us to get right and be saved. Well, working in mental health is kind of the same way for me. It doesn't matter to me what a person has done, is going through. I'm not going to judge them. In anything that God has allowed me to learn, in the skills he's allowed me to develop, I enjoy using those because it's such a reward for me personally to see people become their best person. And even with my students, it's the same with them. When I see one of my students excel or get out there in the world and do something awesome, boy, I stick my chest out. I'm just so excited. So I love seeing people win. You win, I win. And so I'm going to give you, if God puts you in my life at any of those settings in mental health, you become my primary goal. You become my primary thing to focus on. And I give it all I got because I want to see you win. And I'm then so godly proud to see success, whether it's in a small measure or a large measure. So that's where I get my pay, in this mental health field.
And from my perspective, I do a lot of clinical work with, people of all ages. But I think what has been the most rewarding part for me is when I've worked with a child that has been, that's young. And then years later, they come back and so they say, because I've been in my location for some time. So they come back and say, do you remember me? And I'm like, yeah, when they say their name and I kind of could recognize their face. And they tell me how they went from being a child that had trauma, struggle, all types of things that occurred in their lives that would have made them a statistic.
Yeah.
But they tell me, oh, I just graduated from college. I'm working in this field. And to be able to see them and to see where the healing has taken place and how that God has delivered them, that is just probably the most rewarding thing as a clinician for me to experience. And I've had that to happen on many levels where people will find me on Facebook and just say, what, I just want to thank you. I don't know if you remember me, but you were my doctor. So those things where you see the hand of God working in people's lives, that is just priceless.
Yes, it is. So I think we totally agree on that. I told you we were a lot alike, personality and all. So we've got a little bit more time there, and we want to keep it moving because there are some other people we need to acknowledge their challenges in life as well. And let's just talk about just children and maybe even the little preschoolers. Preschoolers, or well, let's just say this, children under 6 years of age. We know that they can be very resilient, and then sometimes not. I had an opportunity to do some research with one of my professors when I was at the university, and her research was on children and resilience, and it was burn victims. And so it was amazing to see how they could be so resilient. But then there are other pieces of research where children can be introduced to things at a young age, and then there's trauma. So you never really know which kid is most resilient and can bounce back, and which one could be traumatized forever as a result of being introduced to something horrific at an early age. And so one of the things that I think we need to be mindful of as parents and teachers and caregivers, if we're around these small children, because we don't know how it's going to affect them, we need to know this, that they tend to mirror the emotions and feelings of their parents. So if you know that as a parent, you need to be careful in how you allow your emotions to come out and display in front of these younger ones, because they're going to take it on. They're going to mirror it. And I know with all of this distant learning going on right now, a lot of parents are frustrated because they're having to help these small kids with homework. And, you know, truth be told, some of us have been out of school so long that if we're trying to help a child with third grade assignment, we could be challenged, because what they're doing now is nothing like what it would have been when we were in third grade. And then the challenge of just being able to operate the Zoom and all these different things that's being brought out during this time that parents are having to learn to do along with their children.
So Dr. Burkett, I have a question, because it's a question in the thing, and you kind of mentioned it. We're using a lot of virtual things. And so one of our viewers want to know, is it more difficult to work with the patient via Zoom or in person? And for me, working virtually can have its difficulties, because you know, there are things that's related to what, like grooming and hygiene, you know, things like that you may not really be able to adequately assess. But I think from an overall perspective, I've had some really good success in doing with the virtual counseling, because I have not been back into my clinic. I haven't been in my clinic since March. So to answer that question, I think it just depends on what is going on with the person, because one good thing is that you can many times view their home environment, which will tell you a lot about the person. And I think so that can be helpful. Because you're looking at them in their natural habitat, so to speak. What do you think when you talk about, you know, our children, and how do we help them from a virtual perspective with all of the things that are going on in their home?
Okay, that's an excellent question. And I'm going to try my best to answer that question, being fair to the educators, all the school districts who are stressed out equally as well, the family members, the parents, and most importantly, the child as a child advocate. Okay, some children are in regular ed and some are in special ed. And, you know, trying to complete these exercises by Zoom can be very challenging if the child is not at least average or in a gifted class. Children who require more instruction sometimes require prompting and all of these things in between, getting them to do that. And that's kind of impossible to do with distant learning. If a child needs hand over hand guidance and things like that, it really doesn't work well. So I know that a lot of the schools are open part-time now, and some days, and the kids may get to go in a day or two here and there, but not every day. I know a lot of schools will open back up and then close right back because there are cases of COVID. This just happened in a city here in Mississippi yesterday. So I think that we're going to just have to be patient with this because it may not go away anytime soon. I think we're going to have to just step up to the plate and learn to improvise as much as we can to make this work. And I think we need to stop playing the blame game, because there's blaming going on right now that's about to develop into some lawsuits. There are some attorneys, special education attorneys right now in California sitting on ready because there are some parents saying, my child are not getting the services that they need, and they are already in special education. These parents are aware of the 504 accommodation. They're aware of Public Law 4294. So they know what we as educators owe their child. But the problem here is this. Okay, when the United States Department of Education came in March of 2020, and set some guidelines, and they set some structure there because they wanted, the Department of Education in each state to know that they're still required to do certain things. Okay, the law is what the law is, but when that law was developed, we didn't have COVID. Okay, so now with COVID, what everyone needs to relax and understand is we're going to have to tweak some things. The child's IEP was not developed during COVID. The child's 504 accommodation was not developed during COVID. So some adjustments will need to be made. And so the U.S. Department of Education has only been mandated to do what is humanly possible at this time. And so if your provider or service providers are sick with COVID, you wouldn't want your child being exposed to that anyway. So I would suggest that parents kind of relax a little bit. And and as a school psychologist, I'll say this. If a parent called me up and said, I need my kid assessed, I need this functional assessment done, on behavioral functional assessment done. And, usually there's a check attached to that. If the child gets certain diagnoses, there sometimes a monetary gain. And so these assessments are usually backed up even without COVID. There's just so many of them being done. But I would say this, just slow down and relax, because you do want your child to be at their best when they're assessed. And if you assess a child right now, they're anxious about COVID, maybe lost a family member, you're not going to get a true picture and an accurate conceptualization of what's going on with that child. If you do educational testing right now, you're not going to get a true picture. So if you're concerned about your children regressing, and if you're concerned about them not getting ahead, the one thing you don't want is some test results sitting there that makes them look like they're not as capable as they really are. So
Dr. Burkett, I have a question for you. You're talking a lot about the educators. And of course, we do have to realize the educators are experiencing the pandemic as well. But what responsibility, especially when there's special education needs, what responsibility does the parent have to make sure that the child is learning during this crisis? Because again, it's not always on the educator. If the parents don't do something at home, and I understand it's very stressful for parents, but they have to be accountable and responsible for their child's learning.
Dr. Douglas, there are some parents right now who are saying, if I have to do this, I want that teacher's paycheck. If I have to engage my own child, if I have to carry out these programs, if I've got to sit here all day and do what normally would occur in a special education classroom, I want the check. And it could be just because that parent is experiencing financial difficulties, have lost a job or whatever. But as a parent, you have an obligation to your child. Absolutely. Even when school was when they came home, you needed to follow up with and continue to do whatever the instructors have written programmatically for the child, because you don't want them to regress. And then one of the questions was, is distant learning at fault for children experiencing these regressions? So my thing is this, it depends upon what is the source. Why is a child regressing? Now, if it's something, and keep in mind on this 504, you've got so many different impairments there. It could be mental impairments as well as physical. So if the child is regressing from a lack of physical therapy and moving. Just for instance, if the child has Rett syndrome, the neurological disorder usually little girls get, and the treatments are so much better now. But if you don't exercise them and move their limbs daily, even if they've learned to feed themselves and they've learned to walk and do different things, they can regress. So the parent, to your point, need to make certain that these things are occurring at home. When you think about regression from the academic standpoint, and I heard someone say even on last night, oh, wow, we're just losing years of instructional time here. Well, that's relative too, because the whole world is being shut down and affected by the same thing.
So with that being said, Dr. Burkett, and for time purposes, as you stated, we're having difficulty on an educational level, we're having difficulty on an economic level, on a social, emotional level, on a spiritual level, and people they're grieving. They're really grieving. There's a sense of loss. People are losing their jobs, they're losing their businesses. So how can we address the issue of grief and loss?
The issue of grief and loss is to go through it. There's no other way to do it except go through it. The only way to heal is to go through it. There's not a back door. There's not a side door. This is a natural thing. It occurs in life. With and without the pandemic, there's going to be grief and loss. There's going to be divorce. There's going to be loss of jobs. There's going to be loss of loved ones. There's going to be loss of a whole lot of things. And you just have to allow yourself as a human being to experience your feelings and go through it. It will be counterproductive to try and jump hurdles and pretend it didn't happen and be superwoman or superman and not allow yourself to experience those feelings and go through the stages of grief. And hopefully at the end, you'll come to acceptance and accept the things that you can't change. And for those things that you can do something about along the way, you address that.
And, I just want to say a lot of times people don't really understand grief, but I tell my patients, I say, grief is a natural emotional response to a loss. Whatever that loss may be, it is natural. And people have to grieve on their own time. And sometimes, especially with Christians, we feel that if we grieve, if we show any type of weakness or emotion or inability to cope, that we don't have faith, that we don't love God enough. And that is just not the truth. We are spirits in a human body experiencing life on a human level, and grief is a part of that. And so we have to be able to accept that and give people an opportunity to grieve and let them know that it is okay to grieve, because this pandemic is truly a traumatic situation to all of us, that when we come out on the other side, we're going to have experienced trauma. We're going to experience that grief. But one thing that we know, that we have a God that is able. He still sits on the throne, and he has not given his power to anyone else, and we will come through victoriously.
And I have 2 words to add to that. Jesus will. So even he experienced grief.
Yes.
Okay, do we have any questions out there that are unanswered that we need to address?
We have one. How do we deal with trauma? Okay, and they're just kind of quoting what you said. How do we deal with trauma? You deal with it by going through it, processing it. And I think also it's important that we get mental health treatment. Not that the mental health clinician or provider has a know-it-all. We don't know it all. We're experiencing this. But I think with our experience in the field, we know how to help people process their trauma, process their grief, and begin to work through it. People kind of say, I want to get over it. I just want to get over it. I tell people, no, you don't want to get over it. You want to work through it. And as you work through it, you can look back and you can see God's move in your life. And that's what we really want to do.
Absolutely. I just thought of something. And you know how we are as extroverts. We could just be all over the place. But I thought about children of divorced parents, and how they must be experiencing this now. And I say that because, when we talked earlier about the children, especially when they're under the age of 6, they're going to have this clingy behavior right now because they don't understand, and they're going to cling to the parent or whoever is there, caregiver wise. It's this clingy behavior, as opposed to off and playing with children, doing the developmental things they should be doing. So I would like to reach out to all of the parents out there who may be divorced and your children are not in the household with you. And I'm going to encourage you to make certain that you reach out as much as possible to that child now that's not with you. You may be divorced from the child's mother or father. And the reason why this child needs to feel your love right now more than ever is because they may already be seeing and experiencing losses all over. Maybe they've lost their grandparent. They know of all these people who've died. And now this anxiety is going to build up in them. They're going to develop separation anxiety. They're going to be very nervous because you're not in the household. They don't know what's going on with you. So if you've got a child out there right now, I say you need to make certain that on a regular basis you connect. You find whatever means necessary, but you connect to give that child a sense of stability, that you're not going anywhere. Yes, COVID is real, but mama still loves you. COVID is real. Daddy still loves you. You still have us, and let them have a sense of safeness. Don't you think that's important?
I do. And I know with the time drawing down, I want to encourage people to continue to be a part of this conference. We have another session that is starting shortly. So make sure that you contact someone and tell them what a great time you had sharing with Dr. Burkett and I, and to really join and watch our colleagues as they begin to share more information on the importance of being able to address issues related to mental health. And remember, with mental health, it is just that. We don't want to focus on the illness. We want to focus on being healthy.
Absolutely.
Thank you all.
Thank you.
I enjoyed you, Dr. Burkett.
Oh, girl, always. I enjoyed you so tremendously.
Can't wait to get together with you.
Oh, yes. We have those plans.
Oh, yes. Oh, yes. Thank you.